Hi guys, Dr. Sandra Lee here. Many of you guys know me as Dr. Pimple Popper. I wanted to talk to you today about acne treatments and the difference between prescription versus over-the-counter solutions. Acne is one of the most common conditions that we diagnose and treat. I mean, most of us have experienced acne in some form over the course of our lives. What I like to remind my acne patients is that acne is not life-threatening, but I know it can affect your day-to-day life and your self-esteem. And while there is no cure for acne, there are certainly things that we can do to treat and manage your acne. I know that if you have acne and you're walking down that skincare aisle at the drugstore, it can be super overwhelming. Everything in that aisle claims to do something different, and some work and some don't. This is actually why I started SLMD Skincare, to bridge this gap between a trip to the dermatologist's office and that walk down the skincare aisle. If you followed me on Dr. Pimple Popper or SLMD Skincare, you're gonna know that I talk a lot about how acne forms. All acne starts as blackheads and whiteheads. This is when your pores get clogged with oil, dead skin cells, dirt, and debris. Then, if a bacteria called P. acnes kind of grows within these clogged pores, that's when you get those red, inflamed papules and pustules that we all know as pimples. So the key to managing acne is 1, preventing blackheads and whiteheads from forming in the first place, which means keeping your pores clear of dead skin cells, oil, and dirt. And 2, preventing the bacteria P. acnes from thriving and really multiplying, which is going to lead to those red, painful pimples. Let's talk about these one by one. There are a few things you can try at the office to help prevent blackheads and whiteheads from forming. One of the most important things we try to do is exfoliate the skin. We use ingredients that we call keratolytics. This means that these products soften the keratin in your skin, the skin cells, and help to more efficiently loosen these skin cells and other dirt and debris off of your skin. The most common topical medication we will prescribe here will contain ingredients like salicylic acid or glycolic acid. These are also ingredients that we commonly use in chemical peels to treat acne for the same reason. Another really common and effective ingredient to treating acne is a topical retinoid. Retinoids are derivatives of vitamin A and are also really effective in exfoliating the skin, but they do this by a different mechanism. Retinoids promote the normal shedding process of your dead skin cells. They decrease the dead skin cells from sticking together, building up, and ultimately clogging your pores. Retinoids also have the added benefit of increasing cell turnover, which makes your skin look more youthful and can really minimize the appearance of fine lines and wrinkles. Medications you're going to see us prescribing here are things like Tretinoin, also known as Retin A, adapalene, and tazarotene. Acne can be really hormonally driven, so oral contraceptives can actually give a little more control over those hormonal breakouts. We also prescribe another medication called Spironolactone, and this has a distinct anti-androgen effect, which also helps with hormonal acne. For patients with severe acne, there's also a wonderful option called Isotretinoin. Accutane is the brand name. It's an oral medication that is taken and is really highly monitored by your dermatologist, but is really effective at treating acne, especially people with severe acne. Another thing we think about when treating acne in the office is how to eliminate any of that acne-causing bacteria from the equation. So for this, we turn to medications with ingredients that serve as anti-microbials. These are antibacterial ingredients that are really effective specifically for the P. acnes bacteria. You'll most commonly find dermatologists prescribing topical medications that use benzoyl peroxide, clindamycin, erythromycin, dapsone, sulfur. We can also prescribe antibiotics in a pill form. Usually they're tetracyclines like Minocycline or Doxycycline. Now, what you should do if you don't have access to a dermatologist, because I know a lot of us don't, and you're really looking for an over-the-counter solution for your acne. When you're looking for products that are gonna help to exfoliate your skin, you can find the same ingredients that we prescribe, like salicylic acid, glycolic acid, and retinol. These same ingredients are also in the SLMD acne products. You can find salicylic acid and retinol in the acne system, as well as benzoyl peroxide, and also individual products like salicylic acid cleanser, retinol serum, salicylic acid spot treatment, resurfacing acne swipes, and the salicylic acid body spray. When it comes to antibacterial products, the most common acne treatment products you'll find over the counter that are truly effective on P. acnes are going to contain benzoyl peroxide or sulfur. These are really effective ingredients that can be found in products that focus on treating acne and can be found in 2 SLMD acne treatments as well, BP lotion and sulfur lotion. The BP lotion is the one that you're going to get in our acne system, and the sulfur lotion is an alternative treatment because some people are sensitive to benzoyl peroxide. So I hope that's helpful. If you really understand how acne forms and what ingredients to look for and for what purposes, you should be able to put together a routine for yourself that really works. Of course, if you're looking for a complete system, I'd encourage you to head on over to slmdskincare.com and try my acne system or any of the other products out there.